Joining us this morning is Bruce Blair, and you've been on the show before.
Yes, I have.
I remember you now.
Yes, I have.
You're kind of filling in for Dr. Stevens. He was scheduled to come on, cardiologist with ACMC. However, he had another appointment and he couldn't make it today, so you're filling in for him. Thank you very much for doing that.
Sure, not a problem.
Appreciate that. You're going to speak today about neurological support groups and also about swallowing rehab, which you are a specialist in, correct?
Yes. Yeah, that's true.
Let's get started with some questions here that I thought maybe you could start answering for us, and then I might have to jump in because I get very curious.
Sure,
That's
absolutely.
Okay.
Absolutely.
ACMC sponsors a support group for stroke victims and their families. Can you
Yes.
tell us about that?
Yeah, we're trying to get one going. There was a very successful one at one time. What we're really trying to do is have some kind of a group where people who have, or their families, anyone who's affected by a stroke or any other neurological problem like Parkinsons, traumatic brain injury, I don't know, there's a surprising number of things that can go wrong with the human brain.
Yes.
But at any rate, we want to have a place where people can come and, socialize as well as get some answers. I'm going to be there. I have a pretty extensive, I've been being a speech therapist since God was young, pretty much. So I know a lot about like what happens to people who have some sort of neurological problem, but what I don't know, I've never had a stroke, so I don't know how to have a stroke in Ashtabula County. You can't get medications except someone will deliver it. Who does? I don't know. Okay, and that's the kind of stuff that people who have gone through it, don't really need to reinvent the wheel all the time. So we're kind of hoping that there's going to be me, there's going to be Denise McNabb, who's a social worker and is in the rehab unit at the hospital. I do outpatient as well as inpatient at the hospital, and also Mike Jones, who's a physical therapist who does outpatient and inpatient. So, and we're going to have speakers, but what we're really hoping to do is draw some folks who just want to share their experience.
Is there a date on this?
Yes, it's going to be, we're going to meet the fourth Thursday of every month. And so that means the 27th coming up, this Thursday is going to be one.
You've had them before, right?
Yeah, we've had two, but the weather hasn't been so good this year.
Yeah,
and we got snowed out a couple times.
Yeah.
We had, with one, a couple people came though, and one lady came who, her husband had a stroke and was in a local facility, and we were able to, give her some advice on what to do.
I was going to ask you
where to go. What do you do next?
When when someone has a stroke, it's the caregiver or the spouse that usually has to help live with this situation.
Yes.
And I would imagine that this would be very important for them.
Absolutely, and that's an extremely good, that's insightful question, because someone has a stroke or has some kind of problem, and everybody focuses on them, and they get all the sympathy and they get all the concern, and people talk to them. The spouse or the caretaker
is over in
a corner. Yeah. Exactly, and they're not getting anything, and they're going through all of these worries and concerns and stuff like that. They're the ones who really need to talk to somebody.
Yes, because they're the ones that have to take over. They have to take care of the bills. They have to maybe if the husband was doing it or whoever was doing it.
Exactly.
And it's a completely different life.
Yes, you're walking down the street minding your own business, and suddenly your whole life has changed.
Yeah.
I tell families all the time, having a stroke is like getting hit by a car. It just changes your whole life,
Sure.
and it's a sudden thing.
Sure.
And you don't know what to do.
Yeah.
So we're hoping that, if we don't know the answer, we can find out, because we have the resources in the Cleveland Clinic. We are the Cleveland Clinic.
You are. Yeah, basically you are. Bruce, and I think we might have talked about this in prior shows and interviews. I have seen recently some pictures of Muhammad Ali, who has Parkinson's disease from getting hit in the head too many times as a boxer. And, oh my God, he doesn't even look the same anymore. He cannot talk, he cannot communicate, he wears diapers. Here was a physical specimen that was on top of the world at one time, and now shot down in his, I think he's only in his 70s, early 70s.
He's not very old.
Not very old, basically, in our way of life.
Or Linda Ronstadt.
And Linda Ronstadt.
The voice of an angel.
Oh,
That's
one of my favorite singers.
That's a professional opinion.
And
That
she
woman
has,
a
she
voice.
got Parkinson's.
Yes. And I read a quote of her saying, well, she doesn't sing anymore because you don't sing if you have Parkinson's. You can't control your voice.
Is that right?
Yeah.
Wow.
Voice is a very big part of Parkinson's.
What a beautiful singer she was.
Yes, she was.
That is so unfortunate. Now, in her case, she obviously was an boxer. How does this happen?
Well, with Linda Ronstadt, she has Parkinson's disease.
Right.
There's an actual disease that attacks a very specific part of the brain that produces a neurochemical that's almost like, the oil in the oil can for the guy in, the tin wood.
Mm-hmm.
Okay. It makes things smooth and helps you out a lot. Muhammad Ali doesn't have Parkinson's disease, he has Parkinson's syndrome. In other words, it looks like Parkinson's disease, but he got a few too many hits in the head.
Which we called punch drunk in the old days.
Exactly. And it hurt the same area that produces that same oil in the can. So that's what the problem is. So he doesn't have Parkinson's, but he might as well have Parkinson's because it looks like that, feels like that. You can't really tell.
He's got the tremors.
I've worked over the years. I've worked with a few people who were at one time, professional fighters.
Really?
And, ended up with the same kind of problem.
Part of his problem was he tried to create the image that he never got hurt. And he would take, I went to a lot of his fights on the movie theaters when they used to show them on movie theaters.
Yeah.
And he'd get hit so hard, one of them by Ernie Shavers, that he would pretend it didn't hurt him. Well, he was standing there, but he was hurt, and he was trying to make it look like he wasn't hurt.
Good luck with that. How'd you like to get whacked by Sonny Liston?
Or Sonny Liston.
I mean, he's a big guy.
Mm-hmm, big guy. And to take those kind of punches all those years, for a long, long time, it came back to haunt him. And unfortunately, this is what he ended up with. All the money he made doesn't matter anymore.
No,
it doesn't matter. So it isn't just strokes that you treat.
No, it's I'll treat anybody who has a problem with some kind of neurological thing. See, I think that a lot of people in the medical community look at diagnosis and stuff like that, but I'm a therapist, and therapists tend to look at behavior. Mm-hmm. Okay, so if a person is having a problem with speech, with voice, or something like that, I try to help them figure out how to get around that problem. Mm-hmm. I don't really care what the diagnosis is, but the typical thing is I'll get diagnosis of stroke, Parkinson's, ALS, then that can be particularly debilitating. Any kind of neurological problem could end up causing some kind of speech, language, voice, or swallowing problem.
Mm-hmm, mm-hmm. I was going to ask you about swallowing.
Yeah, most likely a swallowing problem.
That problem exists with, is it a neurological problem that causes that?
Yes, and very often the case. See, the trouble is we don't really think about it because we just, I'm constantly telling patients in the hospital, you have to not eat like an American, because it's a very delicate, balanced system. It's remarkably complicated. And it's real easy to have something go down the wrong pipe. It's just after millions of years of evolution, those of us who couldn't do it didn't pass on our genes.
Mm-hmm.
But we are overdeveloped, overproduced, and we can get away with it. But when you have some kind of a neurological problem that slows you down or makes things a little less coordinated, it doesn't take much at all to end up putting stuff into your airway instead of the tube that goes to the stomach. Mm-hmm, mm-hmm. And if you're putting things with food value into your lungs are warm, moist, and dark, and that's the perfect breeding ground for bacteria. Mm-hmm. So people just don't understand, for example, until I tell them this, that I'll do an evaluation. I like to start with a little bit of applesauce, because for swallowing, applesauce is God's perfect food. It's hard to choke on it. It's moist, but it doesn't flow. And it has to work its way down through, and your muscles have to put it into the right place while the other areas are being protected.
That's interesting.
Well, it's very complicated, and the hardest thing to swallow is water. And people say, what? What, really? But water doesn't behave itself. Water goes sailing down your throat, and it goes just as fast. It doesn't matter if your swallow is about 2 seconds off, because it's going down because gravity takes it down, and it takes about a half a second. So if the water gets there before you have actually triggered a swallow, it has no place to go except the airway. I was shown, I carry anatomical drawings with me.
Mhm.
So because I really believe that if you're going to fix this for yourself, if you're going to survive it, you need to know how it works.
Right.
So I take out my anatomical drawings to show to the husband of a patient, and he looks at those and he says, "Oh, come on, Bruce, I'm not a highly educated guy. I'm not going to understand your anatomical drawings." And I said, "Well, I don't know, before you retired, what did you do?" He says, "I was a plumber." I said, "Wow, here, look at this." And he understood it better than most people because it's pipes, valves.
Right.
You know, human beings are made of pulleys, levers, cables, pipes,
Right.
valves. You know, we're very complicated, but it still boils down to a mechanical plumbing system.
Sure. Sure.
And if it's off at all, then you're going to be putting food in your lungs, and then that can turn into pneumonia. That's a type of pneumonia.
I remember when I worked at the newspaper years and years and years ago, one of the editors was drinking at the drinking fountain, and apparently was drinking too fast or whatever, and it got stuck here.
Mm-hmm. Yep.
And this is before we knew about the Heimlich
Yes.
Method, and he couldn't catch his breath, and somehow I think somebody hit him on the back, and it popped back.
Yeah.
And he swallowed all right, but it's a scary feeling to know. You know, I felt helpless because I didn't know what to do in that situation.
It's an elemental fear. It's like fear of falling. You know.
Yes,
It's one of the first fears we have. We're born with.
I have
fear of
nightmares
choking.
about falling.
Yeah.
I really do.
Yeah, it's elemental. It's built into that system, so you don't get eaten by a jaguar. You know, so you survive and pass on your
Yeah,
genes. It's
yeah.
the whole point.
Okay. Okay.
Yeah.
Interesting stuff. And the applesauce thing really amazes me. I had
Yeah,
no
that's easy.
idea.
That's easy.
I guess, how do you know that you have a problem?
Well, the whole system, as I say, it's extremely complicated. But the opening to the airway, let's say that this is the laryngeal cartilage, which looks a lot like an open fist. It's right there. You can feel it. And the front of it is your Adam's apple. Okay.
Right.
So right behind your Adam's apple are where the vocal cords are. And there's a trap door over the top of this. Now you would think that sometimes I do like shadow puppets with dogs and stuff, and it's not actually true. Here's your Adam's apple, laryngeal cartilage, vocal cords are inside there. And there's a trap door that comes down only when you swallow to protect that, and then it opens right back up. Behind it is the doorway to the esophagus, and it's a very big, tight muscle because it's trying to keep stuff from coming back up again, so
Right.
you don't choke on reflux. And when the timing is perfect, and when the food gets to the right place, this opens up, this covers, food goes in, this closes, this opens back
Holy
up. And
mackerel.
I know, it's very complicated. So you know, you're doing all of this little tap dance inside your throat. And if you're off,
would know?
if you're off by half a second, it's going to go in the wrong place. Now, here's the answer to your question. Here's that laryngeal cartilage again, your vocal cords. Vocal cords are not made for speech. Okay, your dog has vocal cords. You know, they're made for coughing and choking and protecting your airway. So if something starts to go in your airway, when I lecture on this, somebody always says, you know, what does it mean if I'm sitting around reading the paper, minding my own business, and I start choking on my own saliva? And I said, well, probably that means you're over 50, you know, because you don't feel it quite like you used to. You're not as sensitive. It's not very heavy, and it's body temperature. But once it slips past that demarcation line, that boundary line, and gets into the airway, well, God doesn't want stuff going in your lungs. So you notice that, and you choke like crazy. That's how it's supposed to work, you see.
Okay.
And you blow it back out with your vocal cords.
Oh, darn.
So if you go, then that's how it's supposed to work. It's starting to go into the airway. You kick it back out. You don't even know you're doing it.
Right.
Because all of this
It's automatic.
Yeah, it's automatic, unconscious brain. You swallow twice a minute. People don't know that. You know, I say, when did the last time you swallowed? They say, well, let's say I had lunch a couple hours ago. No, you swallow twice a minute or else you drool.
Is that what it is?
Yeah, you got to get rid of it.
I gotta ask a question. Last week I had to miss 2 days of work because I had laryngitis. Now, is that in my vocal cords?
Yes.
Is that?
Yeah.
And what causes that? I mean,
Well, all kinds of things can cause it. Usually it's some kind of like a bacterial infection, but you could have, a lot of times people get laryngitis and they don't realize that what they really have is a problem with reflux. because stomach acid is battery acid. You know, it's hydrochloric acid.
Brenda Cobb told me that last week. She works for Ashtabula Home Health.
Yeah.
And she said, you know, a lot of times it is reflux.
Yeah, because you're burning, you know, it's a chemical burn on your vocal cords, which are very delicate. And so they get larger because they're little muscles.
And it felt swollen. It's felt swollen.
And they swell up with blood. And then it's like the difference between like the little violin string and the big violin string. You know, they don't vibrate very well. And if they get swollen enough, they don't vibrate at all. And then you get laryngitis. So laryngitis is more of a descriptive term.
Okay.
Okay. Laryngitis is an infection, an inflammation of the larynx. But what causes it? Well, you know, could be from a cold. Could be from reflux. Could be from, you know, you went out and had too much to drink and was shouting at the basketball game. You know? Overuse.
Yeah. Well, that wasn't the case, but
I'm sorry.
But because I don't go to basketball games. I'm not saying about not drinking. But I was having a little reflux problem prior to that happening. And
it causes all kinds of problems. Swallowing problems, too. It can cause. Over a long period of time, that reflux will, you know, that when the food gets in past the doorway and is in the esophagus, and it's like the old-fashioned way of making sausage, all of those muscles squeeze until it gets down to your stomach. But if you've been burning this for years and years and years, that upper esophagus gets kind of calloused, and sometimes the wave breaks down. So you're eating a burger, and suddenly you get this real serious pain right here. Well, the wave went on down, but the food stayed there. So it's going to take a little while, and maybe drinking tiny amounts of water to get the wave started again.
I had one of the readers, or readers, that's my newspaper days, one of the viewers or listeners emailed me and said, you know, you got rid of the laryngitis, but now you have an eye infection. And she was wondering if that was connected to the inflammation I had here.
It's a good question. I'm not sure. Yeah.
You know, but yeah. Oh boy, it's called a sty. Really, it's all it is. But I'll tell you what, they're painful. They're very sore.
Yeah, they are.
Very sore. What kind of things can you do to help with this situation?
Well, anyone who like has been my student or something like that knows how mechanically minded I am.
All right.
I look at the thing as a machine because humans are made of pulleys, levers, and cables. Okay, so you look at what does it take to get something dangerous from the lips, because food is dangerous when it gets to there.
Yes.
Down to the stomach, and what is causing it to be off. And 9 times out of 10, suddenly it's like, you know, they laugh, but I say you got to stop eating like an American. You know,
which is
too fast. Both hands. Down it goes, and we all do that.
We
all get away with it, and it's okay. And I'm not being critical, but if you can get away with it, fine. But if you've had a stroke, you can't get away with it anymore.
No way. Now, like my son, he's the type of guy that will. I don't know why. Maybe since he was a little kid, he will stuff his face, and he's got food. And I go, Steve, slow down and take a breath.
Yeah.
But it's just like he can't get it fast enough.
Yeah.
You know,
so I don't know. It's a cultural thing, but you can't get away with that.
It's disgusting to watch.
Right. Yeah. See, if you have Parkinson's disease, good luck with
No
that,
way.
because you're going to choke yourself. This people like the nurses know I'm going to say this when I go into the hospital and I'm doing an evaluation. I tell people, this is a medical facility, and you're not allowed to choke yourself. If you need to be choked, we'll choke you. We'll get a doctor's order, but we can do that. But we'll choke you. Don't choke yourself.
Right. Don't
because now all of a sudden everything has changed and they're choking themselves. And now what I'm hoping is, of course, inevitably they're going to choke themselves, and then they're going to think of that cheesy joke and my voice in their ear, and they'll cut it out. Because what you got to do is you got to look at this conveyor system and look, okay, how can I get away with what I got now? Well, you're going to have to take a smaller bite or smaller sip, and you're going to have to change the timing of it and get it down a little easier and slower, and then maybe do some exercises to build.
Let me ask you this, Bruce. How successful, or how long does it take to teach somebody that? I mean, we grew up, as you say, eating like an American. Do they, because they're impaired or because they have a disability, do they understand it immediately, or do they have to really learn?
Well, that's another very insightful question. The thing is it depends on what the problem swallowing is and where it is. Is it a problem controlling the food in the mouth, and
Yep.
it goes down too fast because you didn't control it?
Right.
Or is there actually weakness down here? So when everything is squeezing, the timing is okay, but you're pushing it into the wrong place. And maybe you need to be swallowing with your head off to this side so it kicks it all to the good side. You know, there are different techniques you can try.
Mm-hmm.
But, you know, speech therapists are pretty routine at dealing with nonverbal communication. So I've taught people to do things through repetition and stuff like that, and facial expressions as much as anything,
Yeah.
and gestures, who don't understand a word I say anymore,
Mm-hmm.
even though they used to be pretty, you know, they were perfectly normal before.
Right, right.
They take a little longer, but, you know, nobody likes to choke. That's the big thing. You show them what to do and they choke, and they don't choke, and they do it a different way and they choke. Well, you know, that's pretty...
How long have you been doing this?
About 30 years.
As it really?
Yeah.
Did you originally want to get into this kind of work?
No. That's funny, because speech pathology is not the kind of thing where when you're 7 you say, you know, I'd like to be a cowboy or a fireman or a speech pathologist.
Right, right.
No, I was actually an English major at first.
Is that right?
And that was back in the 60s, and, you know, and I was getting close. I got all my English courses out of the way, and I was going to be an English teacher, and then I
Okay.
thought, do you really want to teach high school kids Shakespeare? And I thought, maybe not. So I got out of it, and I did other things, and I was like, I made pizzas for a while, and
Yeah?
I was a roofer for a while.
Really?
Yeah, I did various things.
Even with a degree?
I didn't have the degree yet.
Oh.
I was close to it, but I lived in Bowling Green. That's where I originally went
Okay.
to college. And I'm originally from Madison, but I moved out there to go to college.
Okay.
So what ended up was I started thinking, you know, I'm going to have to like do something. I've got 3.5 years of college. Well, how can I apply this and actually? You know, so it was a business decision. I went back to I went to the department in my college, and speech pathology. Well, no, actually, I went back and I took some tests, and they found that I have similar interests to different kinds of professions, and I was real similar to speech pathology. So I thought, well, okay, I'll give them a try. I went over to the department, and they said, sure, take a couple of intro courses, see if you like it, and we'll transfer all of the English stuff over.
Wow.
And I went for an extra year that way, but you know, then I went straight through with the master's. You have to have a master's degree.
Where'd you start out working at?
I started at in Toledo at the Northwest Ohio Developmental Center.
Okay.
That was very new in the days of taking people out of these nasty old institutions where they used to close people down.
Yeah.
And you know, what we were teaching them is how to be an American citizen and live in a group home.
Yeah.
And it was kind of pioneering.
Well, I go back to that era, and so I know what you're exactly talking about.
Remember Geraldo Rivera?
Yes, very well.
Came out with that thing about the one in New Jersey or New York. And it was right after that when people were horrified to find out how we were actually treating the weakest among us.
Amazing.
Yeah.
Amazing story. Wow.
So that's how I actually started.
Yeah.
But and that's actually, when I graduated from graduate school, I'd never heard the word dysphagia, that's the medical term, for swallowing problems. And then it started, you know, we started getting orders to do swallow evals. And that's how I got involved with it.
How long have you been at ACMC?
A little more than a year.
Yeah, because I think when you first got on the show, you had just been there a few months.
Yeah, it was a long. My last job was in Poughkeepsie, New York. I was in.
Really?
Yeah, I was living in the Hudson Valley. I worked at St. Francis Hospital in Poughkeepsie.
Yeah.
And before that, I worked at Catskill Regional Medical Center up in the mountains.
Is that right? That
Yeah.
beautiful country.
Yes, it's very nice.
Yeah.
But my ears would pop 5 times going up to Harris.
Mine
You know,
mine
'cause
does.
it's
Mine
in the
does.
mountain.
Yeah, mine does that as well.
But I've always had connections with Geneva because my wife is from Geneva.
Okay.
And I grew up in Madison, and probably 40 years ago we had moved away.
Mm-hmm.
But we always came back because of Kathy's family.
Uh-huh.
And so now, you know, you'll never be able to retire in the Hudson Valley without winning a major lottery. You know, a regular lottery
is that
wouldn't do
right?
it.
Is that
You know,
right?
It's a very expensive place.
No kidding.
Oh yeah. Yeah. Well, you know, a house, you could buy a pretty nice house for $100,000 in Geneva. That house in Kingston, New York, would cost you $350,000.
Is that right? What a difference.
Oh yes, and everything is more. We go to a diner. There's like Cup of Joe's. We like to go there in Geneva. It's a lovely diner. Good food. It costs you half as much. We go out to a nice restaurant. We get the bill and we laugh, because it's so different.
Well, I've heard that. I mean, I've talked to people that have gone to New York itself, New York City, or even
City,
California.
yeah. Even worse.
$100,000 house here would cost you $1 million probably there.
Yeah, easily.
You know, and I know guys that got rich on that, you know, over the years. But
you know, $12 hamburger, that's a fact.
yeah, isn't that amazing?
Yeah.
Where you can get them here for a couple bucks.
Exactly.
And used to get them here for 50 cents, but I
Yeah.
mean, it's just amazing.
But you can't
and I like the rural climate that we have here. I mean,
peace and quiet
I
is
like
okay.
it. You know, I don't like a lot of the traffic situations
Right.
and stuff.
Plus, you know, there's a certain excitement in a big city hospital, but ACMC is a fine hospital.
Oh, it's a great hospital.
If something happened to my wife and she needed hospitalization, I wouldn't think twice about having her go to ACMC.
Sure.
And that, you know, I know the difference, so that's a compliment.
You know, your hospital started a new facility here in Conneaut here about
Yes.
3 weeks ago.
Yeah, Dr. Rufa.
And Mike Kabowski was at the council meeting last night, presented council with a plaque complimenting them for welcoming them their new facility here in Conneaut. And Dr. Rufa, who's going to be on the show next week, has become a good friend. He does a tremendous job, and people seem to love him.
People like him.
Yeah, yeah.
And I get a lot of referrals from the Conneaut area too.
Do you?
For outpatient, yeah.
Okay.
See, people misinterpret sometimes what a speech therapist does, because you know, we also work in the schools, and that's the same degree and the same licensure. But probably only half of my outpatient population is pediatric, you know. I treat a lot of adults. A lot of adults for voice and for stroke and for swallowing, and occasionally swallowing with a little kid.
Yeah, I was going to ask you about that before I let you go. Young kids, that's going to be tough because they can't really tell you what's wrong.
No, it's like veterinary medicine in a way.
Yeah, right, right.
You do stuff and you see what the response is.
So, little ones have that problem too. Then.
They can. Well, actually, youngsters can have a stroke. I think the youngest person I've ever done a complete, you know, speech and language evaluation on was probably 13.
That young?
Yeah, who had a right hemisphere stroke.
Oh my God.
Now they have a better chance of responding and getting back to somewhat normal because, you know, they're young.
Still growing.
And
Yeah.
that helps.
Yeah.
But just the fact, I think it's kind of like playing the odds. You know, if you play the lottery for 1,000,000 years, your chances are you're going to win it.
Right.
Well, you live long enough and you might have a stroke. Well, so, you know, 40 is not all that long. But there are still people who are having strokes when they're 40. It's just that, you know, you get older and there's more of the odds.
Sure.
Like there is with anything.
Yeah, well, the odds.
But it's not all
Pretty
that
tough.
uncommon to be treating somebody who's 30 or 40 who's had a stroke.
Is that right?
Although the typical thing is more head trauma, you know. And now they're paying a little bit more attention to concussion.
Big
And
time.
it's about time.
And the NFL had to put that into effect.
Oh, there are all kinds of people walking around who are like a little bit forgetful and
Yeah,
they
yeah.
have problems with routines. And
I was going to mention that.
Stuff like that.
I keep getting questions. I hate to hold you over here, but what about head trauma? Not just say a car accident or something like that. Do you get them referred to you as well?
we do. It's not as common, but we do. The problem with head trauma and concussion and things like that is it's not so obvious. You know, you take a person who's had a major stroke and half of their body doesn't work, and you put them in an MRI and you're going to see spots that don't work. Okay. Usually concussion and head trauma is a little different. It's kind of like a generalized damage. And often a person will show up with a normal CAT scan, and yet they have lots and lots of problems, often executive problems, very frontal lobe kinds of things, where, you know, they leave the stove on after they're done, you know, and they never remember to do that. A lot of occupational therapists work with that same type of thing, just for that, so that people are safe. These are folks who they might, you know, never in their life did they ever forget something, but now they don't remember whether or not they took their medication, and they missed their favorite TV show because they weren't paying attention. So they need to use something like a week at a glance and keep kind of a journal and stuff. And then someone says, well, so did you go to physical therapy this week? And they can flip it over. Yeah, I went at 9 o'clock. There are other ways that you can like work around what you can't do anymore. But most people wouldn't come up with it on their own.
What about dementia patients? Do you handle any of that stuff, or that would be out of your
Not
area?
typically, because usually to be more successful with dementia, you need to be working with the caregivers. Now I've done quite a bit of it working in like skilled nursing facilities and stuff like that. And a lot of times, like if someone has a real problem with cognitive difficulties at SNU, you know, at the rehab center that we have at ACMC, or that type of setting, a lot of times you're teaching the family how to make routines at home and stuff like that, so
Right.
that they can manage it and stay independent as long as they can.
Do you have a number that people can call if they need to get a hold of you? Maybe it's just a spouse that needs some
Yes,
advice.
yeah, yeah. You can call the outpatient clinic and leave me a message. They can connect
Okay,
you to my
and they'll get it to you.
Right, and that's 440-997-6680.
6680. Let me write that down in case when you leave. 997-6680.
Yep.
Okay, Bruce, appreciate it. Excellent stuff here this morning. I learned a lot.
Thank you.
I learned a lot. I appreciate it. Come back and see us again.
Well, I like what I do.
That's important, isn't it?
Yes, it is.